Hello everyone, welcome to my channel. I'm Dr. Sam and today I'm going to be talking about how to study for your national boards or prepare for your INBDE. I know a lot of you have been waiting for this video, so let's go ahead with it, okay? I am not going to recommend things just for the heck of it. I usually tell people what has worked for me or try to make it a point to interact with the right people who have done this correctly to clear it in one attempt. So this information is current. People at the Joint Commission of National Dental Examination or JCNDE have been working on this INBDE since 2009. They've been creating questions for this since 2009. So just rote learning is not going to help. This exam basically combines the didactic knowledge along with the clinical applications of dentistry. So they are testing you as a complete dentist. And the good news is that INBDE only has like 500 questions. So less stress, yay! But the questions are also quite direct, so do not worry. Day 1 has about 360 questions and day 2 will have about 140 questions, okay? Since part 1 has been cancelled, you still have until the July of 2022, that is next year, to attempt your part 2. But if you haven't taken your part 1, then your only option is INBDE. You can give the exam in a total of 5 attempts in 5 years, but each attempt needs to be at least 3 months apart. And the scoring is basically pass or fail. And all of the attempts for each exam are reported. None of the scores are hidden from any schools. So in order to study for the exam, we need to know which topics to exactly concentrate on, right? 56% of your questions will be based on the clinical content. And about 44% will be the rest of it. Out of those 56%, you will have at least 36%, which is diagnosis and treatment planning. Then oral health management will be about 42% of those 56. And then practice and profession will be 21%. And the rest of those 44% will include the basic sciences, pharmacology, ethics, research, evidence-based dentistry, and all of that. And now, the most important thing is about how to study for INBDE. I saw so many YouTube videos and guess what? Everyone recommends the same set of books, okay? But they are missing the most important point, which is how. How exactly do you remember such behemoth amount of information and clear the exam in one attempt? The most important thing that you need to do for such exams, more than just reading, is recall and revise. And how you do this is quizzing. Even before I started studying, I would do the quizzes first, and that way I would know how many questions I actually got wrong. Once you identify what you don't know, then you can concentrate on memorizing and recalling those things. Okay, that way you wouldn't waste time on going over the same things again and again. As a student in dental school, you have to attend so many lectures and practicals, and this exam basically tests you on all aspects of that. Okay, so make sure you are prepared well. And you have to find your weak areas. You have to read, learn, revise, and make mnemonics and remember your matter that way. And you will have to practice. Take a lot of practice tests. One quick way to do your practice is, you can read your material and discuss it with your friends, or ask each other some questions on those topics, or hide the answers on your dental decks and quiz each other on the answers. And I remember when I was studying, I actually did part 1 and part 2. But one of the hardest subjects for me was pharmacology. And then the other one, which was not my favorite, was microbiology. So I definitely made a point to pay more attention to these subjects. You can use books like Tufts Pharmacology for your pharm. it is a short read. You can probably finish it within like 4 to 5 days. You don't even have to buy it. Most people can find it online, and I think that's what I did. And you may also use your textbooks if you are a textbook kind of a person, but trust me, at this point, textbooks would waste a lot of time because you have already gone through your textbooks once during your dental school days. Okay, most people use dental decks out here because they are almost like flashcards and they are easy to remember, short, sweet, and precise. Okay, now some people use some channels here on YouTube, for example, mental dental videos. I've seen those myself and they are amazing. Like, hats off to Dr. Ryan. But let me also tell you this, YouTube is like this amazing website where you get informational videos right at your fingertips, but it's also easy to get distracted on this website, and you would not realize how much time you actually wasted while you're on YouTube. But for everyone, it can be different. So I'm not saying don't see YouTube at all. I'm saying that follow a few people that you like and then listen to their advice properly, while you travel or as a way of revision on multiple X speed, and then have like maybe an hour or more allotted to that in a day, and don't go on it apart from that allotted time so that you don't waste your time in the day. Now, remember, whatever you do, you have to have at least one book as your baseline, either a book or your ebook. Okay, for me, it was my first aid. That was my baseline book, and whatever extra information I got from my decks, from Tufts or whatever, I would just write it down on my first aid book. Or what you can do is, if you're using an e-copy of any of these books, you can just have a screenshot or add notes right next to the area where you want it to be. Having an ebook is more better, I feel, because it's easier to search just by typing rather than going through the entire book. And then you have the JCNDE website has about 47, I believe, INBDE practice questions, which are free. Please go over those. Then there is also the Dental Mastery app or the Kaplan Q Bank. I personally did the Kaplan class and the Kaplan Q Bank, but I felt like it was way more complicated and was not something I was very attached to. Okay, but nowadays, you have this Mastery INBDE app, which gives you around 3,000 questions with patient boxes as well to help you, identify everything. But there is one downside, which I recently came to know for this app, is that it doesn't have many images or radiographs along with the patient boxes. So that might be one of the drawbacks, but it does have a lot of questions. Okay, now ADA practice questions, they are similar to those that appear on the test. Okay, so as many questions and quizzes that you can find, do those. Now aim for at least 3 to 4 months of study. If you're working as an international dentist, if you're working, then it may be like 5 to 6 months of proper studying. But please take an exam date, because as humans, we tend to procrastinate a lot. Okay, and most people, they tend to work better under pressure. You will notice that you will study with more determination, so please do that. Okay, so let me summarize what I said. Okay, dental decks as the main option, then first aid as the additional, then some of the mental dental videos if you need those, and Tufts Pharm. Okay, Tufts Pharmacology, and then all the quizzes that I spoke about. If you do these, you should be golden. Okay, now how do you manage to study? Plan your day. Study for at least a minimum of 3 to 4 hours per day or more if possible. Now everyone's grasping and retention capacity is different, so everyone may need different amount of time. You have already gone through the basics in your school days, So if you are a fresh graduate, it will be way easier for you. If you are an international graduate who has done this a long time ago, then it may take longer. So for international graduates, for preparing for part 1 subjects, set a goal for about 3 months and it should be enough. And for part 2, part 2 subjects, set a goal for about 2 more months, and I think that should be enough. Now, ethics and jurisprudence is not very hard, but definitely do not ignore it, okay? All right, now that we have spoken about how to go about preparing for the exam, let's see what to expect on the day of the exam. Okay, so once you've scheduled your exam, once you enter the Prometric Center, you would have to show them your ID. Preferably, passport is the best form of ID for international students. For students from USA, they can just show them their driver's license. Now, the schedule of the INBDE is such that on both the days, you would start with a 15-minute tutorial, okay? And additionally to that, the first day is 8 hours and the second day is 4 hours, okay? With 15 minutes of optional breaks included after every 100 questions on the day 1 and after every 70 questions on the day 2. And I would recommend to take at least 1 to 2 of those breaks to relax your mind and use the restroom or something, okay? Do not read more in those breaks. Cramming in the last minute is not useful. Usually just set an alarm for like 10 minutes, close your eyes and relax your mind in the meantime. Most importantly, it is very natural to feel like you did not perform as well, after the exam, because most people go through this phase, okay? And this is the reason why you need to solve practice quizzes. You may feel like you scored 70 or 80% correct on your practice quizzes, but when you check it, you may be better. Sometimes you may not be as better in certain questions, in certain subjects. Just retake the same practice exams again and again and keep improving your score. It's going to definitely help you a lot, okay? Now, if you follow all of the information that I shared with you today, then that is all, my friends. That is how you study for INBDE to clear it with your first attempt. Okay, now my goal is to give you as much information as possible out here and help you all in achieving your American dreams. Okay, so if you found this information useful in any way, please like, subscribe, and share this video with your friends who might be in a similar situation. And if you have any questions, please feel free to contact me. Okay, now remember that INBDE can only be taken in the US or Canada, and you would need to visit these countries for the same as an international dentist. So apply for your passport and visas in advance, okay? Please check out my videos on how to get your educational credentials evaluated, and also how much does it cost for the whole dental school applications, right from ECE to DDS in 2021. I will be adding some more videos about visa applications as well, okay? Now, all of the links for these books are listed below in the YouTube description, all right? Adios for now.